Hi everyone, I'm Alexandra Jones, the editor of The Ophthalmologist, and I'm here today with Dr. Kjell Gundersen, ophthalmic surgeon who works at the iFocus Eye Clinic in Haugesund in Norway. We're here today to talk about the iStent Inject W from Glaukos. Dr. Gundersen, first of all, could you tell me how the iStent Inject W fits into your glaucoma treatment algorithm?
Before iStent Inject W was introduced to my clinic, we had only three options in that algorithm: either IOP, reducing eye drops, laser surgery like SLT or ALT, or filtrating surgery. iStent Inject W came along and filled out that space between simple eye drops, laser, and the filtrating surgery, and giving a very valuable addition to the tools that we have to use in this patient cohort.
Fantastic, thank you. And could you tell me about your adoption journey and the learning curve for the iStent Inject W?
Ahead of being introduced to iStent Inject W, I'm working in a very busy cataract clinic and perform more than 1,000 surgeries per year. So that kind of experience is really in place. I'm very happy to say that the education I got from Glaukos was very good. We started out with a theoretical basis, followed by a good dry lab, and then during the first 10 surgeries, I had an experienced expert behind my back to support me in that transition phase. After that, it was a very steep and short learning curve. So let's say I was quite comfortable with the surgical procedure quite fast.
That's great. And what impact has the device had on your practice?
To be frank, like I touched on earlier, I got a new tool in the toolbox. Of course, glaucoma patients can be ranged from mild to moderate to advanced glaucoma cases, and iStent is nothing to introduce in all categories, at least in the beginning. So, but to have a new tool for patients that either don't accept the traditional treatment with eye drops or laser, or don't want to do that, or for any reason search for another therapy, it was very nice to have a new treatment option.
You talked about mild to moderate glaucoma patients. And for those patients who suffer from cataracts at the same time, could you tell me why it's important to address the mild to moderate glaucoma at the same time?
The cataract procedure is a very common procedure among the same age cohort that we will also find glaucoma patients, mild to moderate. And in my practice, I would regard that probably around 20% are either on medication or in a position to start medication for high pressure. So while planning for the cataract surgery,
a lot has been published recently on the quality of life associated with trabecular micro-bypass surgery. Could you tell me how important dealing with the ocular surface of the eye is when you perform surgery using the iStent Inject W?
I would say I'm very glad that during the past 5 to 10 years, there has been a rising interest and knowledge, both scientifically and clinically, about the significance of a good and healthy ocular surface. And we do know, every doctor that really works with glaucoma patients know that their ocular surface is suffering in many cases. based on the fact that we don't have alternatives, we have to use preservative and drugs, and it acts toxic, either the substance itself or the preservatives that we have used. So having an access to an IOP reducing procedure and strategy that could eliminate the need of potential toxic agents is something that is really highly appreciated.
Dr. Gundersen, you've been using the iStent Inject W for several years now. Could you give me the reasons why you've been using it? And could you perhaps talk about some successful patient outcomes and your experiences using this device?
I started using the iStent Inject W in 2018, so it's not more than 3 years out. And I've touched upon it earlier that the learning curve was steep and fast. And since then, probably around 300 procedures has been performed at my clinic using this iStent Inject W. It has, let's say, when we control our results, we find that we are very much in line with the international studies that has been published. Around 80% of our patients can be regarded as successes, either by reducing the IOP or combined reducing the IOP and reducing the need for IOP reducing agents. So we find that the results at our clinic is almost exactly the same that has been presented at larger series, which is very comforting. You can expect to have the same results if you follow a very strict and easy protocol.
Dr. Gundersen, thank you so much for talking to me today about the iStent Inject W from Glaukos. It was a pleasure talking to you.